Good afternoon. Thank you for listening again today. As of 2 p.m. today, there have been 2,722 positive cases of COVID-19 in Missouri, including 39 deaths. Over 30,000 Missourians have been tested at this time. As I announced on Saturday, SEMA, Missouri One Start, are all teaming up to recruit medical professions not currently part of the workforce to join the Missouri Disaster Medical Assistance Team. Since Saturday, we have received over 900 applications. So first, let me just thank all the Missourians who stepped up, heeded to the call, and over 900 of those people have volunteered to help in this crisis, and I want to thank them, and all Missourians should thank you for stepping up to do that, and I appreciate that so much. We greatly appreciate that, and to be part of that workforce is just so important for us. And again, I can't express how many of you contacted us over the weekend, but 900. We'll go through the application process now to get everybody screened and get them to work as soon as we can on that. Today, Director Carson is here to give us an update, so I'm going to turn it over to her right now for an update. Director?
Thank you, Governor, and good afternoon, everyone. I, too, want to join Governor Parson in saying thank you to all the folks who volunteered when we issued the call on Friday for additional folks for the DMAT team. We have a group of HR professionals as well as the DMAT experts who are going through the applications, and we will be expeditiously hiring those that we can fit into slots that we have current needs. So thank you. I also invite others with professional medical licenses in these areas like medicine, nursing, allied health, dentistry, and biomedicine to consider joining this effort. Based on the models we're seeing for COVID in Missouri, we will need additional personnel to assist at medical facilities, including the alternate care sites that we're currently making ready. The national news headlines over the last 36 hours have been that COVID-19 deaths are leveling off or dropping in New York, and the state of Washington may have reduced the peak of its coronavirus caseload. But this is a multi-front war, and the coronavirus continues to spread. Different areas of the country will hit their peak counts for infections, hospitalizations, and deaths at different times. In Missouri, our curve is still climbing, so we need additional resources and personnel in this fight. I urge professionals to consider joining the Mo DMAT 1 team. These are paid positions, so if you are assigned, you'll be paid for your work. We need people who are able to work 12-hour shifts, and this is not something you can do remotely from your home. It's preferred that you've had patient contact within the last 6 months. For people registering on the DMAT website, you must include your medical license and your resume when you register. To register, go to on.mo.gov/join-DMAT. Again, that's on.mo/join-DMAT. Thank you again to Missouri's medical professionals for responding in such outstanding numbers. Finally, today, I want to provide you a quick update on the federal disaster declaration that Governor Parson successfully requested for Missouri. This disaster declaration means local communities can receive reimbursement for qualifying COVID response costs. Under normal circumstances, after a disaster declaration, our state emergency management team would immediately begin organizing in-person meetings to explain how to apply for FEMA assistance in areas impacted. To ensure we are socially distancing, SEMA is conducting those briefings online, with many communities already providing applications online for assistance. We thank all of you for making this process go quickly, and so far it's gone smoothly. As we continue to fight against COVID-19, we will continue to adjust and adapt to keep our local communities safe, while still providing the services Missourians have always relied on. Thank you.
Sandy, thank you very much. Thanks for the update. As COVID-19 crisis has developed, we have also been communicating weekly with the infectious disease and critical across the state. Their expertise and their guidance is critical to our COVID-19 response efforts, and we greatly appreciate their time and assistance. One of those doctors, Dr. Stephen Witt, is here with us today. Dr. Witt is a Senior Associate Dean of Clinical Affairs and Chief Clinical Officer at the University of Missouri. He is also an Associate Professor of Clinical Medicine specializing in critical care and infectious diseases. Dr. Witt is here to talk to us about what it really means to stay at home and social distance, as well as additional steps to continue fighting the spread of COVID-19. Dr. Witt is one of 8 infectious disease experts we talk weekly across the state of Missouri, in all different parts of the state of Missouri. So he's been a great advisor for me. He's been great for the governor's office to be able to talk to him and keep us up to date on what's really happening in the front lines every day. Dr. Witt.
Thank you, Governor Parson. A few messages I'd like to give today. Social distancing has been effective at slowing the spread of new infections, but we must remain vigilant. The rate of new infections has leveled off across our state and across our region. Our hospitals are able to keep up with the needs of the seriously ill, and we now have more people in the recovery phase than we have new infections. A few things about social distancing and staying inside. Staying at home does not mean stay inside. Avoid groups, keep your distance from others for sure, but please go outdoors, go for walks, get exercise by yourself and with your family, go fishing, do hard work. Simply going outside or riding in a car is not an indication for a mask. The air is good for us, and the air itself does not cause COVID-19. If you need health care, please seek it. Our Missouri healthcare facilities are prepared to continue to provide excellent care for our ill. We have implemented processes to ensure patient safety during on-site appointments. Many of us have shifted how we deliver care using electronic methods and different buildings, segregating from COVID populations when possible and necessary. And lastly, I'd like to make a plea to please help each other. The current precautions will likely be needed for many more weeks. The elderly and those with mental or physical disabilities need groceries. They need supplies, they need medicines, and they need help at home, things that can be safely picked up and delivered to them. Please check on each other, encourage and uplift one another, and your thoughts and prayers are very much appreciated. Thank you.
Thank you, Dr. Witt, for the briefing. During our Stay Home Missouri order, it is important for us in state government to remove barriers to keep Missourians moving forward. COVID-19 has forced us all to social distance and stay home as much as possible. However, there are many important personal and business transactions that require the service of a notary public, commissioned by the Secretary of State. This process assures that documents are authentic and can be trusted. Unfortunately, current law requires that that person be physically in front of a notary to authenticate these documents. Today, I signed an executive order waiving that requirement. This will help protect the health and safety of Missourians who wish to execute changes to their important documents. Today, Secretary of State Ashcroft is here to provide some more details on that executive order. Secretary?
Good afternoon. Thank you, Governor. I'm very pleased that the Governor has enacted an executive order that will allow people to continue to transact business that requires the use of a notary with physical distancing. It is important, obviously, that we fight this virus, but it's also important that we remain to be the state that we are and understand that there's a light at the end of the tunnel. And this is just one more way that your elected officials are working together to make sure that the people of Missouri and the state of Missouri will remain resilient and will come out of this strong and with a brighter future. So our office will be putting up a website. I think it'll go up tomorrow with some answers, frequently asked questions about this executive order. Anyone that has questions about it should feel free to reach out to our office. But to simply put it, for we've been working to get this done, and thanks to the governor, it's going to get done during these circumstances. I still hope the legislature will enact on it, but this is a great way for the governor to help the business of the state continue and to make sure that people can continue to do what they need to do to survive and be prosperous once we're through with this. Thank you very much.
Thank you, Secretary Ashcroft. I also want to speak on behalf of the Secretary also when we were trying to figure out ways that we could save funding and how we were going to make some of the cuts because of the economy, the shape it's in. Secretary Ashcroft took it upon himself to figure out how they could be more efficient, how they could do things better to help some of the other people across this state by cutting his own funding. And I appreciate him for making that sacrifice for the people of this state on that. Kelly, questions today?
I do. I have several, Governor. I have several for you, and then one for Dr. Hood and one for Secretary Ashcroft. First one, Governor, is from Summer Ballantyne, AP. Governor, do you plan to start wearing a face mask, and why or why not?
I do not plan on wearing a face mask at this time. However, that being said, as I well know in this virus, things change daily. Right now, I think the recommendation, if you feel like wearing one, you could wear one. And I have no opposition to anybody wanting to do that. But right now, I just probably will be one that doesn't wear one until things change or I feel like there's more of a need to it. You know, we've took every precaution here at the governor's office. We're limited to how many people can even come in the office. We know who comes in here and every day. And again, it goes back to I'm trying to practice the same thing that I'm asking the people of Missouri to do. It comes back to social distancing. You know, we have to maintain that at work, and just same way for me and the First Lady, whether we're at their mansion or whether we're here, how to do that, and we continue to maintain that. But right now, I don't plan on wearing a mask at this point.
Okay, thank you, Governor. This is from Alyssa Nelson, Missouri Net. What milestone did we hit that prompted you to issue a stay-at-home order?
Well, several. Actually, we look at the data every day here at the governor's office, and several things. We look at bed space, for example, in the state of Missouri, and what part of the state of Missouri has the most risk for those bed spaces to be, which part of the state has a higher risk pool than other portions of it. How many ventilators do we have out there every day? How many people are truly in the hospital? And how many people have truly recovered from the coronavirus? You also have to look and see, as a governor, look at all counties across the state. And it was less than a week ago, there was probably 90 some counties out there that had 3 cases or less within their counties, and still 40 counties that probably don't have any. See, those numbers kept going up every day. And then the decision becomes is when you do that order on that. So, and I think keep in mind there was orders in place all along in the urban areas early on. But I think the one reminder I'd like to just remind everyone, the first order I done in the state of Missouri was the most strict order we have done. It was no more than 10 people could ever be grouped up together and 6 feet apart. That was the first executive order I did for the state of Missouri.
All right, Governor, this is a twofold question from Kurt Erickson, St. Louis Post, and Brian Hosworth from Missouri Net. What will your administration do if the legislature is unable to finish its work on budget for the next fiscal year because of concerns about the coronavirus?
Yeah. Well, first of all, I believe we are going to get a budget done. We have till June 30th to get that done, the end of June to get that done. And I do believe there'll be time in there that we'll have the opportunity to come back. I think by then, hopefully, we're going to be on the downside of this virus. But the Constitution says we got to do that. So, frankly, me and the legislators got to figure out a way to do that. It's the only way we can move forward in the state of Missouri. We don't have the luxury of printing our own money, and we just can't start over with not abiding by the Constitution. So I really believe by the end of June, we'll be able at some point to call a special session, bring the legislators back in, and to be able to work on the 2021 budget.
Okay, thank you. This is from Jeff Bernthal, Next Star. Could you repeat again on how the enforcement of this stay-at-home order is going to be carried out?
Yeah, it's been that way since the beginning, but basically it's going to go back to the local authorities, the health departments there, would go to the courts to get a court order to enforce either a misdemeanor, a fine, whatever it be on the local areas. But again, it would be up to them to go to the courts to file a case in the courts, and then they would take action they deemed on the local levels.
All right, thank you. This is from Steve Dunning, Hearst Communication. Viewers tell us they can't log in or have forgotten login information and can't get it sent to them or can't get through on the support phone system for unemployment in the Department of Labor. Can you talk a little bit about how they're trying to fix that problem?
Yeah, let me just say this. The director is going to be in here tomorrow to speak on this in more detail than what I would. But I can just literally tell you, there is hundreds of thousands of people calling by phone, by email every day. And needless to say, it's overwhelmed. There's no way to sugarcoat that. I mean, there's just a lot of people every day calling in about that. However, I do want to say that 90% of the people that have got those claims filed in have got it completed. On that every day, we have brought additional staff in. I think they have over 100 people over there now trying to communicate through the phone systems and how to be able to get people to handle that. But it's a continuing problem, and it's going to be until it slows down a little bit. But you know, I'm confident the director, I'm confident that department will get this fixed. But right now, it's just an overwhelming situation here. But believe me, they're working hard on it to get that done, and I think tomorrow she'll be able to come in with more details on that for the people of the state.
All right, Governor, I think this is the last question for you today, but it's Ethan Stein from KOMU 8. At an earlier press conference, you said urban areas are having more success than rural areas keeping people home. Since most urban areas were under stay-at-home orders at the county or city level, is that proof a stay-at-home order at the state level earlier would have been more effective to stop the COVID-19 from spreading?
I think that, and I'll go back to what I said earlier. The first executive order we done was 10 people, 6 feet apart, and there was no exceptions, none. That was the first order we did in the state of Missouri, and I do believe that was the right order at the right time to be able to do that. I think, again, as people start learning, the people start to understand how serious this is, and I think all along, for almost 2 weeks, we've stayed there in front of the camera and said, Missourians, you need to stay at home. The mayors are saying, stay at home. Our medical staff are saying, stay at home. I mean, that message is finally, I believe, soaking in, and people are starting to understand how important it is. And when you actually see as many people that are hospitalized that we've seen, the deaths that we're seeing, I mean, you know, everybody's taking a real serious look at this and realizing, hey, I got to do my part. And I don't think any piece of paper is going to tell Missourians, you know, exactly what to do. I think if they're smart enough, I think they got enough common sense and realize, hey, this is a serious enough thing. We got to take it upon ourselves. As I've said all along, it's the personal responsibility of everybody in this state to do the right thing. And I think people are doing the right thing.
Okay, thank you, Governor.
All right.
Dr. Witt, I have one question for you, please. This question is from Jacqueline Driscoll, St. Louis Public Radio. I know you touched base on it earlier. I want to make sure that is clearly answered. Is COVID-19, do you consider it airborne?
There have been a few studies that have shown that you can detect parts of the virus from air samples. That is different than what's an epidemiological spread pattern called airborne spread. What we see is that the virus has been exhibiting droplet spread or contact spread. And we also know that mitigation factors that are meant to protect people from droplet spread are working. And so so far it does not look like it has that it is significantly airborne spread.
Thank you. All right, Dr. Williams, I have a couple of questions for you, please.
Thank you.
This question is from Bridget Lavelle from KY3 in Springfield. The governor mentioned that on what would happen on Friday, but it still is not talking about the numbers of the people that have recovered and why that's not on the website yet.
Yeah, Bridget, thank you for the question. As you know, on Friday, we put the data from the Missouri Hospital Association. One of the things we hoped to put was both the admissions and the discharges, and the Missouri Hospital Association is unable to capture the discharges. So we do know how many people are being admitted. I will tell you from other states that it's about 75% of people go home. That when you look at Seattle, I think would probably be similar here at some point. The average stay for people who are not on a ventilator is about 12 days in the hospital getting oxygen and support. And the average stay for people on ventilators can be longer. It is, as Dr. Witt and I were talking about earlier, ARDS, no matter where you get it, tends to be a disease that damages the lungs and keeps you on a ventilator. But I think one point we always want to emphasize is that 90% of people that get tested for disease come back negative, and 80% of the people who get the disease don't end up in the hospital, and the majority who do get well. So I think that's an important thing to remember.
Thank you, Dr. Williams. This question is from Reed Wilson, The Hill newspaper in D.C. Hearing lots of states are having trouble buying vents. Specifically, they get as far as then the Fed, usually FEMA, comes in and outbids them. Have you all heard that happening in your agencies?
We have not. We purchased 220 ventilators, and we have 123 in reserve. As the governor said, we watch the number of ventilators in our ICU beds like a hawk. We see them every day. We have about 2,000 ventilators in Missouri in our approximately 150 hospitals, and right now we have about 1,100 available. And we also watch it very carefully by region. One reason I'll give some very encouraging. First time since before March 23rd. Today I got a phone call about 1:30. I get a phone call every day from the lab telling me how many tests were done and how many positive. And for the first time before March 23rd, we had no tests come back positive today from our state lab. And those are done in real time. Those are done in 24 hours. Now, we did have an increase in our commercial labs of about 300, but they're often batched and may reflect a longer period of time. But to reiterate what Dr. Witt was saying, it was about 2 weeks ago that the governor put in the social distancing. And so this is encouraging to us. And the other thing that's very encouraging to us, Dr. Witt and I were talking about earlier, is Missouri's flu rate is almost down to zero. It's fallen precipitously. It's been a tough flu season. It was a late flu season. But we're in a better off place now in Missouri from the flu than we have been in the last 3 years as far as ending early. And if you think about it, when the flu goes away, it really makes the number of people walking around with a fever and cough a lot less. So we use less PPE, we do less testing because there are not as many symptomatic people. So when we look at our vents, one thing we're really looking at, and the governor's looked at very closely, is our prevalence of disease. So these things make us just really reiterate the importance of social distancing.
All right, thank you. I have one final question. This is for Secretary Ashcroft. This question is from Jason Hancock, the Kansas City Star. Secretary Ashcroft, should Missouri send an absentee ballot to every registered voter to avoid people congregating at the polls for municipal elections this summer or the statewide primary in August? And the second part of this, should other measures be put into place before the November elections to ensure Missourians can cast a vote even during a pandemic?
Well, thank you for that question, Jason. The first answer is that under, I think it's 115.277, but I could be wrong. I don't have it in front of me exactly. The absentee ballot statute does not allow the Secretary of State's office or election authorities to proactively send out absentee ballots to people that do not meet the requirements of the statute. So for us to do anything like that, it would take the legislature to make a change, and then of course to be signed off by the governor if that's something we want to do. So right now in our planning for the municipal elections, for the August elections, and for the November elections, we are planning that we will not have that ability. Now that doesn't mean that we won't. I've been working with, everybody you could think of, from the Clerks Association to the governor's office. I've been talking to other secretaries of state across the country about potential things we might see done by the legislature. Been working with legislative leadership on those possibilities. So we do hold out hope that if we need changes to be made, they can be made by the legislature if they come back. But secondarily, we have to plan for the idea that potentially we will not have any sort of legislative reprieve and we'll have to hold the elections under current law. So we're planning on doing that. We are identifying polling locations that will not put people at risk. We're identifying poll workers. We're identifying new procedures and methodologies to allow people to vote. Is that expansion of our curbside voting? Is that setting up drive-through voting like we have with drive-through testing? Is that disposable marking devices so that no stylus that's used on a poll pad is touched more than once and it's only touched by one individual? We are getting PPE ready. We are getting disinfectants ready for our elections. My biggest concern is what happens in November, because We are still in uncertain times, but I think that we can see that as people are physically distancing, at least according to the doctors who know far more about this than I do, it's making a difference. Missourians are making a difference. So I'm feeling better and better about the municipal elections in June and the August election, but there is some concern that in November, potentially, it comes back. So we are striving to run our municipal elections as a prototype, if you will, as a dry run for how we would run November elections if the COVID virus were back and even worse. Because it's our job to make sure that we plan for everything. People of the state can enjoy the right to vote and use it.
Thank you.
Let me, before I go to closing remarks today, over the weekend I had the opportunity to talk to some of the medical professionals across the state and some of the first responders. I just want all Missouri to know how proud I am and from being the governor of the state of Missouri and see some of the most remarkable things going on in our state in the medical profession with what doctors are doing to be able to meet the demand in the hospitals, what the CEOs of the hospitals are doing to free up more bed space, what they're doing to really make sure that we got enough ventilators in this state, and how they're dealing with it, with a critical situation every day. It is amazing, and those people that keep coming to work and keep coming to work and keep coming to work every day. For our first responder, police officers and firefighters who have not had the gear they need and the PPEs, that we would sure like to be able to do a better job of making sure they're equipped. Still going to work every day, doing their jobs, meeting the calls and everything. And when you think about all the people, the great people in Missouri, and I think about those people who are willing to go out there and work every day, take the risks they take, only now they're taking greater risks, but continue to keep doing their jobs across this state. It is amazing what people in this state are doing. I'm so confident Missouri will find the solution to COVID-19, and we're going to win this at the end of the day because of all those people out there on the front lines that are working hard every day. So just appreciate everybody. Keep them in mind as we go through this week, especially. To just keep them in your minds every day of what people are doing every day that's helping meet the demands of everybody at home. I want to remind everyone, as I have for weeks now, stay home, Missouri. The order took effective today and will remain in place through April the 24th. We know there have been a lot of questions about the specific guidelines of the order. The full order and a list of frequently asked questions are available on our website. The bottom line is this: everyone should be staying home and reducing public contact as much as possible. However, this does not mean you should remain in your home and never come out. That is not healthy for anyone. It's okay to go outside, get some fresh air, take a walk in your neighborhood. You can still go to the store, the pharmacy, to get essential foods and supplies, but you must abide by the social distancing guidelines in the order. Like I said, this is a time when we must all make sacrifices. We will get through this, and we will be okay. But it's going to take all Missourians following this order. So again, be smart, be responsible, and stay at home. God bless, and thank you for listening today.